Think of a region where marketing respects children, where public spaces are free from manipulative ads, and where youth-led content sparks policy conversations. Think of workshops that equip creators with facts and storytelling skills, and of coalitions that turn viral momentum into legislative change.
Healthier diets are not simply a matter of willpower. They are the outcome of systems designed to support people and the planet.
Every individual has a role to play. Share your voice, join a challenge, attend a workshop, or support local advocacy.
When communities, evidence, and policy align,
change becomes inevitable.
This is our shared responsibility. This is Shape Asia.
On behalf of Shape Asia, I am pleased to welcome you to today's webinar, Measuring and Tracking Food Environments in Asia, Evidence for Policy Action. We are honored to convene this discussion with distinguished speakers, researchers, policy partners, practitioners, and colleagues who are working to strengthen the evidence base for healthier food environments in the region. The theme of today's webinar is both timely and policy relevant. Across Asia, food environments are changing rapidly due to urbanization, expanding retail systems, digital food marketing, shifting consumer practices, and the increasing availability of ultra-processed foods. These changes have important implications for diets, health equity, and the prevention of diet-related non-communicable diseases. In this context, measurement is not simply a methodological exercise. It is a foundation for policy action. What we measure determines what becomes visible in policy debates, what problems are prioritized, and what interventions can be designed, monitored, and evaluated. Robust and context-sensitive food environment metrics are therefore essential for accountability, implementation, and regional learning. This is where Shape Asia seeks to contribute. Our vision is to help shape an inclusive and healthy food future for Asia together. Our mission is to support healthier food systems and policy environments across Asia through collaboration, evidence, and advocacy. Shape Asia functions as a regional community of practice. We bring together policymakers, researchers, civil society actors, and other stakeholders to generate, synthesize, and translate evidence into policy-relevant actions. We recognize that food environment challenges in Asia are diverse, but they are also interconnected. This makes regional learning, comparative analysis, and collective action especially important. Our work is guided by 5 core pillars: sustainable food systems, healthy food access, active learning, policy and advocacy, and education and empowerment. These pillars reflect our commitment to food environments that are not only healthier but also more equitable, inclusive, and responsive to local realities. Today's webinar directly aligns with this mission. We hope the discussion will help us reflect on several important questions, like how can food environments be measured more effectively in Asian contexts? What indicators are most useful for policymakers? How can data systems capture equity, implementation, and real-world complexity? And how can evidence be translated into policy action at national, subnational, and regional levels? I would like to sincerely thank our distinguished speakers, Professor Boyd, Professor Eric, Professor Renuka, Visakha, and Pulasti. We are grateful for your time, expertise, and contributions to this important conversation. Once again, welcome to everyone. We look forward to a rich and productive discussion. Over to you, Dinity.
Thank you, Professor Barason, for that important framing. We will now move into the presentation session, and today we are privileged to hear from 5 distinguished speakers representing leading institutions across the region. It is my pleasure to introduce the moderator, Dr. Nisha Arunatilaka, for today's webinar. Dr. Arunatilaka is the Director of Research at the Institute of Policy Studies of Sri Lanka and the country lead for Shape Asia Sri Lanka. I invite her to share an overview of today's objectives and agenda and proceed with the presentation session and the discussion. Over to you, Dr. Arunatilaka.
Thank you, Dinity, and welcome everyone, and thank you for taking the time to join us today. We all know that our surroundings heavily shape our daily food choices and our overall health. Public health policies and regulations have the power to fundamentally change these environments and improve population health. But how to influence these policies? We believe measuring and tracking food environments can be leveraged to motivate governments to act. With that backdrop, to understand exactly how this works, we've brought together a group of experts who are actively measuring and tracking food environments. Over the next hour, we will explore innovations in measuring food environments, what data reveals about modern food environments, and why it is important to measure food environments in different ways, taking different perspectives. We hope this knowledge exchange will help to strengthen collaborations to improve food environments in Asia, a core objective of Shape Asia. So without further ado, I shall proceed to our expert presentations. Our first speaker is Professor Boyd Swinburne. He is a professor of population nutrition and global health at the University of Auckland, New Zealand, and honorary professor at Global Centre for Preventive Health and Nutrition at Deakin University, Australia. He leads the Informas initiative to monitor and benchmark food environments across more than 70 countries. He is recognized globally as a pioneering expert in the prevention of obesity and the systemic reform of commercial food environments. So with that, over to you, Professor Boyd.
Thank you very much indeed. Thank you for that introduction and thank you for this invitation. Congratulations on getting this webinar up and running, and I really appreciate being invited to it. So next slide, thanks. So I'm going to talk about Informas, which is an international network for food environments, research, monitoring and action support. And we conceptualized this in 2012 with a small group of people you can see there at a meeting in Italy. And the following year published 14 papers with about 20 odd protocols for measuring different aspects of the food environment. We pilot tested them in 2013, 2014 and put them out for global implementation. And next, thanks. We're now entering decade 2. Next slide, thanks. So last year in November, we gathered people from around the world. You see 37 participants from 19 countries to go through all of those protocols and those modules around measuring and monitoring food environments and converting that into advocacy and policy change. So we wanted to revise them all. We wanted to identify future directions for Informas and plan that strategically. Next one, thanks. So before we went to Mexico and meeting, we had a survey of the countries that have been involved just to evaluate where Informas had got up to in the previous 12 years. So there were 72 countries involved. The majority were low middle income countries, 140 institutions, 629 protocol implementations around the world. Not just back. Thank you. Importantly, Informas having these protocols there and available and ready access to international networks is really attractive for having for masters or PhD students to get involved in research. So a lot of the research has been kicked off by them. Lots of papers, lots of multi-country comparisons. We did get a lot of details from countries about how the evidence was converted into policy development, and we'll be analysing those and running some case studies this year. We've done a lot of regional network meetings, satellite meetings, conference symposia, webinars, newsletters, and so on. So this really is a very active network that you can learn from. Next, thanks. So this is just a snapshot of the first bit of the country matrix. You can see the first handful of countries there, and you can see the various modules going from public sector, private sector, and so on. And the numbers in the boxes are the numbers of papers published on those those parts of the food environment. Overall, the public sector module, what we call Food Epi, is the one that's had the most uptake, but food composition and food promotion have also been there. And then on the right-hand side, you can see the number of postgraduate students and number of institutions. So it really gave us a sense that these protocols are being widely used, they're good for students, and they're being converted into publications and policy action. Next, thanks. These are the countries that have implemented them. It's been very active in Latin America, and their regional work, regional networks have been spectacular. The European countries have been coming together by using these large horizon projects, multi-country projects, in which Informis methods have been included. The African region is developing quite quickly with a lot of good networking, and the Asian region is coming along with a number of uses of the protocols, but not quite as strong networking at this stage. So I'm hoping that Shape Asia is going to lift that up. And then Australia, New Zealand, and Canada have been working as a sort of a group together. The US is nowhere to be seen. They haven't really been participating. Okay, next slide, thanks. So this is the structure of the Informis framework, and for each of the ones in the blue, orange, and purple, we have protocols to be able to use. So public sector action, private sector investment and trade, and then those 6 parts of the food environment, and we also have some protocols around population diet. Risk factors and health outcomes are usually done by countries or WHO, and we've now been including sustainability and equity within each of those protocols. Thanks. So we've got in these new papers that will be coming out later this year with all of the updated protocols. We've got a new definition of food environments. We're framing it as the interface between people and the wider food system that influence food acquisition and consumption practices. So we're not talking about consumers so much here, but acquisition and consumption. But also they affect individual nutrition and health status and some broader outcomes. Lots of new methodologies have arisen in the last 12 years, and these are now being incorporated into the protocols, and sustainability indicators as well as into some of them. And also we're beefing up the translation to policy with collaborations with the Global Health Advocacy Incubator. Next slide, thanks. So the action in Asia has there's been strong around food retail, and you can see that for traditional stores, for convenience stores, for street food and supermarket, there's been a lot of pilot testing of new protocols. The original food retail protocols were mainly centered around supermarkets in high-income countries, and so this really does add a lot of added protocols. Food promotion, there's been a comparison of TV advertising across 9 Asian countries, and that's been really valuable as a capacity building process. The Food Epi, which is the public policies, and the BIA Obesity, which is the private sector modules, they've had lower uptake than most regions. Most countries will start off with a Food Epi to give them a plan of what's happening, and Thailand was very early out. Very early on, Thailand implemented all of the modules, so there's a lot of expertise in Thailand. The regional collaborations and networks is critical, and for Asia, this has been less prominent than in other regions, so to be able to lift that for Asia is really important, and this webinar is a great start. So I'll finish there. Thank you very much indeed.
Thank you very much, Professor Boyd, and thank you for being on time. and explaining to us what you have done. I'm quite amazed because you have covered a lot of ground in terms of different sectors, scaling up in globally, and also changing with time and leveraging new technology to improve measuring food environments. So thank you very much for that. We will have the discussion at the end of all the presentations. So let me move on to our next speaker, who is Professor Eric Finkelstein. He is a professor of economics at the Duke NUS Medical School, Singapore, and the executive director of the Lean Center for Palliative Care. He specializes in the economic causes and consequences of health behaviors. He is widely recognized for his groundbreaking work in the economics of obesity, behavioral incentives, and end of life. So over to you, Professor Finkelstein.
Yeah, thanks so much, Nisha. Can everybody hear me okay?
Yes.
Great. There's a lot of chats. I'm not sure if people can get in. I'm just following along, but I guess I won't worry about that. So yeah, thank you guys so much. Can we go to the next slide, please? So what I want to do is talk about a lot of the research that we've done here in Singapore, and increasingly, or at least a few studies beyond Singapore, using what we call NUS Smart. And basically, if you go to the next slide, I'll tell you just, sorry, next slide. So just by way of background, and I won't dwell on this, but even in Singapore, dietary risks are now the number 3 leading cause of disability in Singapore. And in fact, as you can see, up 89.6% over a 10-year period. And in fact, if you look down the list, it's really chronic diseases. And, in every developed country, I think we're seeing something similar. So certainly addressing, if you want to improve population health in developed countries, you really have to focus on diet quality, which I'm sure everybody here knows. So if you go to the next slide, one of the things that I think we all believe is that just telling people to lose weight and telling people to eat healthier is just not enough for lots of different reasons. But in any case, what it means is that we need to do more than talk. We need action, and we need policies that will encourage people to make healthier choices. So if you go to the next slide, sorry. What we did in Singapore, and this is going back about a decade ago, we created a fully functional web-based grocery store called NUS Smart, which at this time I would argue rivals some of the off-the-shelf stores that you would see. And we built it really for testing interventions aimed to improve diet quality. And basically you can, as a researcher, we can influence anything that consumers see, and we can actually customize this at the level of the individual participant, which is something you couldn't do in a bricks and mortar store. And as you know, shopping online is increasingly popular. And in fact, in Singapore, because most people don't have cars, online shopping is really popular, and people have the products delivered right to the homes. And so we took advantage of that, and we've done a series of studies aimed to test the influence of various interventions on diet quality. And so what I'll do in the next couple of minutes is just show you some examples of how we've used NUS Smart, with the hopes that maybe some of you on the call might get excited to use this in your countries, and we can talk about some collaborations. So if you go to the next slide, I'm just going to bang out a few of the examples. And so, sorry, next slide. So Singapore has what's called a healthier choice symbol. And basically, the symbol identifies products within food categories. So say, for example, within the cakes or cookies or within the sugar sweetened beverages that they think are better than others. And so I had this belief that if you identify quote unquote healthier foods, that people might actually overconsume those foods, and that might actually make people take on greater calories. And so we tested that And we also tested it in combination with something called physical activity equivalence, would basically say how much you would have to jog to burn off the calories in a product, which we had heard might be an effective strategy to encourage people to consume less. So if you go to the next slide, well, actually, sorry, back up one slide just to show you. So it turns out that basically, sorry, previous slide. Yeah, the labels did influence purchases, but not necessarily in the way they were intended. And in fact, it certainly had no influence on reducing calories. And so if your goal is to reduce obesity and diabetes, we thought this might not be the best label. And we published this. And so if you go to the next slide, we had discussions with the Health Promotion Board at the time about maybe thinking more about the negative labels that have been done in Mexico and Chile and other places. And so we tested the high in sugar warning labels, or like the cigarette type labels, and we found both of those labels actually reduce consumption of the targeted products. And so we sort of suggested that, negative labels targeting bad foods are potentially more effective than positive labels targeting better foods, because you don't have the potential for overconsumption as you would with the healthier choice symbol logos. So if you go to the next slide, we had talked with Singapore, like the Nutri-Score, but they adopted a version of Nutri-Score called Nutrigrade, which sort of has both. So you have the letter grade that identifies the A and B foods, and in fact, in Singapore, that's optional, and then you have mandatory C and D grades. And so before this was rolled out, we tested it using our web store, and in fact, we did find that the Nutrigrade label positively, and this, by the way, at the time was just for beverages, but in fact, it's been expanded now for food categories, with the expectation that if it works well, they may expand it to all foods. But in any case, it worked in sugar, reducing sugar intake. And so that was the primary intent of Nutrigrade. It didn't work in saturated fat, but that's largely because most beverages don't have saturated fat. So from a sugar and calorie perspective, from a sugar perspective, this was probably effective, or at least we showed it to be. But again, no significant change in calories, which may not be so surprising given that it displays sugar, but it doesn't display calories on the label. So if you go to the next presentation, next slide, here we were trying to take advantage of customization, and the idea that as people shop, it would be nice to be able to show them in real time how their basket were changing. And so if I had more time, I would show you, but basically as people shop, you can see this wheel, their My Cart summary gets better or worse as they shop based on the products that they're adding to their electronic basket. And we also showed them sort of, some characteristics about what would be an appropriate basket in terms of red, yellow, and green categories. And we found that this dynamic food labels and real-time feedback was effective. And on this version of the score, you could change the label to any either Nutrigrade or Nutri-Score, or basically any NFP variable, that nutrition facts panel variable that you were interested in. This worked quite well. And if you go to the next slide, we actually, this was a neat study where we were testing taxes. But it turns out when you implement sin taxes on foods, there's a couple different ways that you can do it. One is you can just do it implicitly, so the price goes up, but you don't acknowledge it as a tax. And in fact, if you tax inputs, like if you're taxing sugar, for example, then you do see a higher price, but you don't necessarily see it as a sin tax. But other countries, for example, like the Philippines, explicitly acknowledge which foods are taxed, and they say this is taxed because it's an unhealthy product. And then we also compared that to a fake tax, where we basically said this was an unhealthy product, but we didn't actually raise the price. And we looked at it. And so if you go to the next slide, what we found was that this was a paper we published in Economics and Human Biology, that basically taxes certainly work. It shouldn't be any surprise. But in fact, about 2/3 of the effectiveness of explicit taxes was the messaging that accompanied the higher prices. And so implicit taxes are generally not going to have as large an effect as the ones where you can show very clearly that you're taxing this food because it's unhealthy. Next slide. So here's one where we basically threw the kitchen sink at consumers. We thought about everything we could incorporate into the web store, including before they checked out, we gave them options to swap out their products with healthier versions. We had ordering effects. We clearly labeled them with the red, green, and yellow foods. We told them what a healthier basket was. We gave them feedback. And in fact, if you go to the next slide,
Professor Finkelstein, your time is up. If you can wrap up.
Yeah, sure. So, okay. So, but in any case, worked really well. Next slide, please. Okay, so I'll skip this one. Next slide. So basically, just to say, this has been a really great tool for us. And in fact, you can see there's a couple studies in Bahrain that we've done. We've done 2 in Saudi Arabia and quite a few in Singapore. And we can do these with hypothetical or real shopping. So if people are interested, we certainly would welcome collaboration. So I will stop there and thank you guys again for the opportunity.
So thank you very much, Professor Finkelstein. It's very interesting because you worry about not only just giving information, but understanding how to present information and also understanding how in different ways using new technology, you can nudge consumers to purchase healthier food, like your food basket example. That is very innovative. Thank you very much for that very interesting presentation. So our third speaker is Professor Renuka Silva. Professor Silva is a distinguished Sri Lankan academic and the chair of nutrition at the Vayamba University of Sri Lanka. He is a leading national expert in human nutrition, dietary policy, and food security. He is a registered nutritionist and the past president of the Nutrition Society of Sri Lanka. So over to you, Professor Silva.
Thank you very much for the introduction, and I hope that you can hear my voice and also see. Should I share the slides or are you going to share?
No, we will be sharing it. Yes, we can see you. Go ahead, we can, yeah.
Okay. I can't see the slides. Okay. Can you move on to the title slide, please?
Can you see the slide now?
I see the slide number 2. Can you move on to the okay, that's right. Yeah. Yes.
Title
okay.
slide?
Yeah, yes. That's fine. Right. So today I will introduce you the plant village food in Sri Lanka. That's an innovative AI powered tool that combines the dietary assessment with the food environment planning. So this entire forum is on the food environment. Traditionally, we have to measure the diet and the food environment, but it is very, very time consuming and costly. And also we have to rely on the self-reported data. So this Plant Village Food app, this is a smartphone app. This offers a new approach by using smartphone-based image capture and artificial intelligence to generate real-time information on food consumption, nutrient intake, and diet quality, and also some information about the food environment exposure. So in this presentation, I will discuss some of these the technological works and how it works and the future applications. So next slide, please. Right. So one of the, as I mentioned, one of the main challenges in food environment research is understanding how the environment in which people are living, working, studying, or shopping ultimately influence their health. So according to the slide, framework given here, the food environment do not directly cause obesity, diabetes, or the cardiovascular disease. The most important pathway between the food environment and the health outcome is dietary intake, what people are eating. So this is where the funny, or this we now call this as Plant Village Food app, becomes very, very valuable. This app can capture the dietary intake in real time through image-based dietary assessment and generate indicators such as dietary diversity. If you want to know how much of fruits and vegetables a person consumes, how much of milk consumed on a particular day, simply what you have to do is take the photographs of all the foods that you consume time to time since morning until your dinner time and upload them. So it automatically real time gives you the nutritional composition, how much of energy that you consume, and so many other information. So by measuring these dietary indicators at scale, the app provides practical way to understand how food environments are influencing the diets and ultimately health outcomes. The next slide, please. Still, I can't see the next slide.
Yeah, the brown.
Okay, right. That's fine. So before discussing the further application, let me briefly tell you what have we done. So first, what we have done was adding all the kinds of the most common foods in Sri Lanka, the recipes and the individual food items, the dishes, the curries, various things into this app, and therefore we enable the plant village food, that is how we call this app, that can identify foods, estimate the portion sizes, and assess the dietary intake. And this is very, very comparable to the other standard dietary assessment methods. You might have heard about the 24-hour dietary recall, diet diaries, or the quantitative, semi-quantitative food frequency questionnaire. We compared our app with those standard dietary assessment methods, and this is validated. So that's the importance of this app. Next slide, please. So let me quickly tell you how Franny works. Very, very interesting. So what you have to do, just capture the meal image, and the app identify the food using artificial intelligence algorithm, and then estimate the portion size. You don't have to do that. The system identifies the portion size and then calculate the intake. Not only the nutrient intake, but it calculates the diet quality indicators. Right? Finally, not only that, at the same platform, it can deliver personalized feedback, whether you are eating right food or not. And that is very, very important for the behavioral change messages, making it useful not only for measurement, but also for intervention. So that's important. Next slide, please. Okay, I'm waiting for the slide. Okay, let me
It
start.
should be there already.
Yeah. Okay. Right. There are so this little bit crowded, but the slide says what does Plant Village Food measure? So it measures food consumption. At the time we consume the food, it gives you what you are eating. Number two, it gives the portion size from meal image. Number three, it gives you the energy intake. How much of energy in this estimated portion size? Not single food. You can just put as typical Sri Lankan all the foods on one plate. Just before you eat, take the snapshot. It gives you the total energy which is on your plate and the other nutrients. Micronutrients, several micronutrients, vitamins, minerals, carbohydrates, fats, everything. And in addition to that, as researchers, you can look at the diet quality indicators, dietary diversity, whether the sufficient amount of the recommendation has been met or not, food group consumption, and the healthy eating scores. And with some modifications in future, if this the Shape Forum would like to use this app, this can be tailor-made and customized to measure some food environment indicators. Next slide, please.
Please go ahead.
Okay,
Professor.
I just want to show you our recent publication, which is published in the Journal of Nutrition, which shows the validation of the framing. And very interestingly, I don't want to go into details of our study design. The next slide, please. This shows the intervention of the Franny that we did with adolescent girls. So what we did was, let's say that one group of a control group participated without using the Franny, the gamified nudging messages. So as I told you earlier, this gives some messages telling that, okay, you haven't reached your 5 a day fruits and vegetables today, and you have eaten more sweets yesterday, something like that, which help the consumer to change the dietary patterns. So in this study, in a nutshell, I just want to show you that we showed lower consumption of sugar sweetened beverages among intervention group once they get the nudging messages, and also they increase the dark green leafy vegetables, some other fruits, and the deep orange fruits. So it works. It really works, and these, at least for these adolescent girls. So the next slide. So that's my last slide. So what we are actually planning to do with Plant Village Food, now this is available to download in Google Play. So everyone, it's free. You can download, but certain features are not available for the users. But as researchers, we can use some additional features when you are using. So simply, what is our plan for the next few years? We want to, at the moment, we are validating it with some other groups, including university students, other young adults, etc. And beyond research, we want to use this as a tool to monitor the school nutrition, early warning, monitor the school nutrition, early warning, monitor the school nutrition. And also we can use this to promote food-based dietary guidelines. We are going to use with school athletes to track their the food intake, and also we can use this for at the supermarkets for personalized food shopping. And also not only that, we are going to introduce this to dietitians and the healthcare providers, and also the corporate wellness programs can use this, and the people can change their dietary behavior. So the take-home address, next slide. What in conclusion, this the Plant Village Food app demonstrate how digital innovation can strengthen both dietary assessment and the food environment monitoring. So this platform enables real-time dietary assessment, and it supports the evidence generated for policy action. So based on the not having the dietary data is one of the major problems in taking policy action. So this is a very scalable, and this can be customized in low resource setting, because dietary assessment is really difficult and time consuming. And finally, this platform offers new opportunity for monitoring food environment if it is little bit customized. So thank you very much for listening. And I must thank all our collaborators in US, Ghana, and several other countries who helped us to develop this app over the last 3 years, and also the PhD student Nirmini Karunaratne and my colleagues. Thank you very much.
Thank you very much, Professor Silva. So, with your presentation, we went from monitoring food choices at the supermarket, shopping basket level, as Professor Finkelstein's example showed, to monitoring food choices at the personal food choices at the plate level. So, let us move on to our fourth speaker, Miss Vishaka Tilakaratne. She is a partner director at Multi-Sector Development Solutions Limited and an independent consultant for Scaling Up Nutrition, Sun People's Forum. And she is a prominent Sri Lankan development worker, food technologist, and activist with over 30 years of experience specializing in food and nutrition security. She is widely recognized in Sri Lanka for her extensive work across government, private, and non-profit sectors, as well as her consultancies for international UN agencies. Over to you, Visakha.
So thank you very much for thinking of the community, because I think the community obviously is the target audience with all our endeavors, but actually looking at food environments through what the community can do and what they would extract and how they would get involved is very important, especially for verifying all the scientific research that we do, all the measurements that we do. So thank you very much again. And I will not move to slide 2. I mean, we have just taken these definitions because the community is being spoken about. So how would the community kind of see these definitions? So it's not for the experts, because you are well versed with what the food environment is. So I'm just flipping through and going up to slide 5. The importance of community engagement in food environment monitoring. So I think we spoke about very, very interesting, aspects and insights into measuring and tracking the food environment. Now, how does the community enhance and kind of add value to all these, exercises? So it's always where the contextual understanding would be reinforced. And so we have a number of, topics here, which gives also subtopics on the importance of community engagement in food environment monitoring. So, I mean, these are pretty obvious, but it also gives the importance of involving the community. Again, I think reading off the slide in the interest of time, we can go pretty fast. And also the next slide continues. And I think in this presentation is very important more to illustrate it and give color to this whole topic by actually, giving real life experiences and examples. So just a brief about the strengthening of monitoring the environment through community engagement. Obviously, the community can do a lot because they are the closest, they are within their food environment, but they are close to the ground. So very often we have seen in Sri Lanka, not so much, but around the world, the community mapping of food outlets. Then taking part in participatory assessments and surveys. Then we have also got an example actually in this presentation of citizen reporting and observation, and then also involving the community in the validation and interpretation of findings, and then of course formulating collectively, because it's all about participatory development, the community, practitioners as well as scientists working together for action really at the various levels, but in the case of the community, it needs to translate back into the local level. I'm now going to give in the next slide a small example of actually empowering communities to demand safe food, something that the Scaling Up Nutrition People's Forum has done as part of outreach work with the Food and Agriculture Organization, which has now a big program in Sri Lanka to support the development of food safety systems. So we have got involved through our 300 civil society organizations in all 25 districts of Sri Lanka in strengthening communities to demand, even more than advocating, to demand safe food. And this is slide 8. And in slide 9, you will very briefly see how the capacity amongst community members has been developed through a cascade system, starting from master trainers to training of trainers, then forming consumer societies, and also involving trade associations who have to respond to the demand of food safety, which is a key aspect in the food environment. And so it goes down in a trickling effect. And finally, we are trying to change the behaviors of consumers to look at their food environment and to demand safe food, but to look at it from the beginning of the value chain right until they consume. That is the interesting part. Proactive capacity building for proactivity. And of course, the community-based methods used and which are applicable in Sri Lanka very often. Participatory mapping, then of course the popular household surveys, and this also has very often some aspects of the food environment. And now we have of course come up with photo voice, to take photos and speak through the photos, very, very simple, cost effective. Then there are many vendor interviews that go on outside of mainly the larger supermarkets and the larger shops. Then also community scorecards and GIS mapping and citizen reporting through mobile tools. Again, we have a lot of online applications that people can actually interact and give their views and say what they have actually done actively to change the environment. So this is one example under the food safety, demanding food safety on the part of community. This is a mobile tool that we have, an app that we have developed, where all stakeholders who are involved in this whole chain of assuring food safety could actually log in and report the issues in the food environment with regard to food safety, and also to report on what has been done to resolve, or what are the intermediary actions that are being done. So this is very interesting, and it serves as an excellent monitoring as well as a self-learning tool for the target audience. So let me move to slide 13, which also gives you, what types of responses and what type of education is done through this app. And it's very interesting, very often see the populating of this, app. And a little bit of evidence from engaging the community in food environment studies. We have the Colombo Lived Experience Food Environmental Study. I think it's the Colombo Urban Lab. Then recently, a lot of concentration around school food environments. There's an entire program around it, supported by UNICEF especially. So the GIS assessments around the schools. Then there are desk reviews, of course, that the community supports, but it's really not done by the community, but the community is an interface there. And of course, in the recent Ditwa disaster, lots of community consultations on what they have eaten, what is available, what do they think of the quality, and so on and so forth. And of course, many market research, especially on impacts of food price fluctuations, especially during the economic crisis. So the key findings you can see on this slide. Again, not unknown, but very interesting. And FAO has also done a baseline study amongst the community on their take on food safety, which can be shared. And you can see the obvious, how infrastructure affects access, and they understand healthy eating, what barriers are faced. And of course, the main topic of conversation is affordability. And it reinforces the need for a structured, continuous community engaged mechanism. So the recommendations are institutionalized community monitoring, that's slide 16, and to train volunteers and our public health midwife networks, which are a major part of the primary healthcare system. And as Professor Renuka was explaining, to use simple digital tools to assess as well as to nudge and to change behavior. And at the local level, it's very, very important to integrate with local government planning through the findings, especially mobile vendors and so on, who are given space under local council, laws, and to ensure feedback loops to the community. I mean, what have they engaged in, what have they given as contributions, and what changes are made, and how they should participate within these changes. So, very briefly, for future streamlining, if the community is to be engaged in a structured manner, we have to be very clear about indicators. And these indicators should be in a national repository for comparison and to be a base for policy changes. And mixed methods, obviously, like in assessments, need to verify, triangulate what is found. And the engagement of youth is very, very important because they are active, they go around, and also sometimes less than optimum habits are, practiced by youth, and they are the future to especially prevent NCDs and cross-sectoral partnerships like what we do very often, engaging the community, CSOs, government, and the private sector. So I think that is what I have to say, and thanking you all for giving this opportunity. Community engagement, very important. They should be in the driving seat and not only be a source of data. And I must profusely thank Ishani Rangajiva, my colleague and student of Professor Renuka, who has done an immense amount to contribute to this short presentation, which was done in rapid time. So thank you very much.
Thank you very much, Ms. Tilakaratna. That is very interesting to find out how you engage the communities to not only monitor food environments, but to involve in them in influencing policies. So thank you. With that, we will move on to our fifth presentation, Dr. Pulasthi Amarasinghe. He is a research fellow at the Institute of Policy Studies of Sri Lanka. He is the recipient of the ANH Science Policy Fellowship in 2025. His core expertise spans labor, health, development economics, and social welfare programs with a heavy focus on food security and public nutrition policy in South Asia. So over to you, Pulasthi. Pulasthi, can you hear us?
Can you hear me?
It's a bit muffled. Can you increase the volume?
Can you hear me now?
Yes, that's better.
Okay. Yes. So good afternoon, everyone. So thank you to Shape Asia for inviting me to speak today. And I'll be talking on measuring what matters, tracking food security, food advertising in environments, and nutrition information visibility in Sri Lanka. So the broad public health concern behind this work is that there's a growing burden of diet-related NCDs and the increasing exposure of children and consumers to unhealthy food marketing in Sri Lanka. And here we already have several regulations related to food labeling, advertising, misleading claims, and even child-directed promotions, which are quite recent. But the key issue we are trying to address is not simply whether laws exist, but can we systematically observe whether these rules are followed in practice? I should say at the outset that this is still work in progress. The research and the frameworks are still being developed, and we hope to share further progress with what we are trying to do. But the main argument today is simply we are looking at food advertising policy and how it cannot improve unless we first measure the food advertising environment consistently. So in terms of food marketing regulation, especially for Sri Lanka, we have several regulations. First, you have the Food Act and food labeling and advertisement regulations. So they cover food labeling claims, restrictions on child-directed promotion, and even using children in advertisements children under the age of 12. And the Consumer Affairs Authority also acts in these matters because it deals with misleading and deceptive advertisements. And of course, you have the broadcast and media that have general sort of advertising content standards in their own regulations. So the issue is not that Sri Lanka doesn't have regulation. The issue is that the regulatory system is difficult to monitor in a routine and also an actionable way. So really looking at it through three gaps. First is that the monitoring is not routine or it's not systematic. In the sense that we do not have a continuous mechanism that tracks advertisements across, television, social media, and other platforms. And social media and digital platforms, which is my second point, is that it is covered legally, but it's very difficult to monitor in practice. You see this not just with food, but also with alcohol and tobacco, where you have strong regulations in place, but or not regulations are in place, but they're not necessarily able to cover these platforms, and children and young people are increasingly exposed to these promotions through these platforms. And of course, you have even with these regulations and coverage, the compliance evidence is not really packaged in a way that the regulators can act on quickly. So basically, even if you identify, this advertisement is problematic, it doesn't really provide a big picture for the policymakers to take action. So of course, so for any policy improvement, we first require knowing what's happening in the current environment, and that's sort of what we are trying to do in our work. I'm working with the University of Colombo Faculty of Medicine, Professor Taranga Thoradenia and Dr. Roshan Heva on these. But can we go to the next slide? So what we measured in terms of advertisement, so we look at measurements in two sense. So of course you have the regulatory violations. These are a little bit difficult to violate in traditional media, but you have social media and these digital advertisements which continually have children, or not necessarily children, but they use these claims and they exaggerate what the ads can do, which are out of the scope of the regulation that are already set in place. So but it's not just the regulatory violations that we are looking at. Of course, this is important, but the second dimension is the visibility of the product information and also the advertisement tactics. This is something that the policymakers themselves raised as an important concern when we discussed with the Health Promotion Bureau that you do have a vast set of regulations, but there are ways that people get around it. And I have done work in the traffic light labeling, and we have some work coming up where we look at the visibility of traffic light labeling in advertisements. And what we see is that there is correlation with the content in traffic light labeling and its visibility. For example, I'm putting a direct example in the slides where you have the red labels being blocked or hidden through advertisements. So these are tactics that are being used, and this is something that the policymakers requested as information. And so these are the visibility of product information categories that we are trying to measure in looking at advertisements in general. So basically, the distinction here is that it's a very important distinction for policy, right? So for compliance system, it may miss important questions if you're just looking at regulatory violations, right? So, but because we need to ask questions that go further, especially on, is the information visible enough to help consumers, make healthier decisions. So can we go to the next slide? So what we do here is a food advertisement tracker. So this is a prototype that's first prepared by the University of Colombo Faculty of Medicine, led by Dr. Roshan Heva and Professor Taranga Thoradenia. So IPS is partnering them for the next phase to include, labeling related information and the visibility of, other food advertisement tactics as well. The prototype was, of course, developed, and this is a small snippet of what it does so far, but we plan to extend it to have these technical regulation, red flags, as well as the visibility red flags as well. So how it works is we have a software, we have a platform where you can upload ads, and then it links the advertisements to the nutrition profile, including the traffic light labeling. And there's a structured annotation, meaning that the coders use structured framework where it allows them to record whether a required information is present, if it's visible, if the advertisement targets children, and these are time-stamped, and whether these have potential compliance concerns. And a key part of this is there is an expert review and approval process. So we are in the process of incorporating AI technology to look at this as it's already there. But there is an expert review and approval process that looks at the coding itself and provides judgment. For example, deciding whether an ad is child-directed or whether its health claim is misleading may not always be obvious. So an expert review also helps the consistency and the reliability of this information. And finally, the platform also exports compliance-related data sets and reports. Basically means that the regulators and advocacy groups do not only receive raw observations, but it receives more of structured evidence that can be reviewed and acted upon with minimal additional processing, basically with the data that's there. Can you go to the next slide, please? So the broader gap that we identified through this is that food marketing regulations exist, but without monitoring, it's difficult.
Sorry, Tulasi, your time is up. So if you can quickly wrap up.
I'll just I'll summarize this. So what we are trying to do here is that we are trying to systematically monitor, how to close these gaps when it comes to the compliance, and also make sure that there is some sort of behavior change over time. So basically, we are trying to create a baseline to see what's really happening across the platforms and product categories when it comes to advertisements, and we're trying to map compliance in terms of which companies, which platforms, which products have the highest violations, and then packages evidence in a way that is presentable to the regulators, and also allow the monitoring system to continue so that we can, as researchers, look at industry behavior following these regulatory actions. And this is quite simple and scalable in any sort of resource constrained setting, because this is simply done by a browser platform, and we are happy to discuss any sort of collaborations and sort of comparisons that can be done across different countries, because this is very adaptable to the existing regulatory definitions. So overall, what we are trying to do is a very unique system for Sri Lanka to really allow policy enforcement when it comes to food advertisements, and to ensure that the current policies that are in place can be used effectively. Thank you.
Thank you very much, Dr. Amarasinghe, for that very insightful presentation, and also reminding us it is not only important to create good policies, we have to also ensure that those policies are properly implemented and there's compliance. So before we go into the panel discussion, we believe that the voices of young people are essential to conversations about food environments that will shape their futures. So we now would like to hear from Ms. Nurina Ramesh. She is a youth leader and sustainability advocate based in Malaysia. She currently serves as the director of AYO Enviro, one of the affiliates under ASEAN Youth Organization, IO. And Nurina has professional experience in marketing, communications, and stakeholder engagement. Over to you, Nurina. Yeah,
Thank you so much. Am I audible to everyone?
Yes, we can.
Okay. I'm not sure whether you can see my face because I couldn't see anyone from just now. But today I don't have any slides to show you. But good afternoon, everyone, and thank you so much for the opportunity to share a youth perspective on measuring and tracking food environments in Asia. As young people across ASEAN, we often encourage to make healthier food choices. However, our decisions are not shaped by knowledge alone. They are influenced by the food environments that surround us every day, like what food is available, what is affordable, what is convenient, and increasingly what is promoted to us online. So for many young people, especially students and young professionals, affordability, convenience, and accessibility play a major role in determining what we eat. Even when we want to make healthier choices, those options are not always the easiest to access. In some rural communities, for example, healthy foods may be available but difficult to obtain consistently. In urban areas, healthier options often exist, but they can be more expensive than less nutritious alternatives. Like for example, like salad bowl in KL is around 15 to 25 ringgit. And then fresh fruit cup is around 5 to 10 ringgit. And then healthy grain bowl is around 18 to 30 ringgit. But when we look at the other options, unhealthy options, instant noodles, for example, is around 2 to 4 ringgit, sweetened beverages around 2 to 5 ringgit, and fried snacks is around 1 to 2 ringgit. So we can see like there's a significant differences between the prices between the healthy version and the unhealthy version. So basically, one way to address this gap is to make healthy food the easier choice. This could include increasing access to affordable healthy meals in schools, universities, and workplaces, supporting local food producers, and ensuring that nutritious food options are available in places where young people spend most of their time. This is why measuring food at risk environments is so important. Beyond tracking food availability, we should also assess the affordability, accessibility, convenience, and the factors that influence young people food choices. So better data can help us understand not only about what food is available, but whether healthy choices are realistically within reach for different communities as well. So at the same time, the way young people interact with food is changing rapidly. Like for example, today, food choices are influenced not only by markets and restaurants, but also by food delivery, like Grab Food or Foodpanda apps, social media, and digital marketing as well. So many young people are exposed to advertisement for ultra-processed foods every single day. And these digital influences increasingly shape our eating habits and in the long run. So as we strengthen food environment monitoring, I believe we should also pay greater attention to the digital food environment as well. This includes understanding how food delivery platform, online advertising, and influencers affect dietary choices, and exploring ways to promote healthier options through these same channels. So I would like to highlight the importance of involving youth directly in the data collection process. So too often, data is collected about young people rather than with young people. There are many ways to change this. So young people can participate in food diaries to document their daily food choices, spending patterns, and the factors that influence their decisions. Community mapping activities can also help identify where healthy and unhealthy food options are located around schools, universities, workplaces, and neighborhoods as well. So digital surveys and social media engagement can provide real-time insights into emerging trends and also behaviors as well. So one of the other things that we can do is that youth-led focus group discussions and citizen science initiatives can also help uncover barriers that may not be visible through traditional surveys. So for example, like a survey may tell us that healthy food is available in a community, but conversation with young people may reveal that it is too expensive or it is too far away or simply less convenient than other options that there are in the market. So these approaches not only generate richer and meaningful data, but also empower young people to become active contributors to policy development rather than passive recipients of policy decisions. So as ASEAN continues to address nutrition challenges and strengthen food systems, I believe we have opportunity to create food environments that are healthier, more equitable, and more responsive. More responsive to the realities faced by young people. To do that, we must move beyond collecting more data and focus on collecting better data that reflects lived experiences, captures both physical and digital food environments, and include youth voices throughout the process. So the question is whether healthy is the easiest choices for young people to make. So Thank you.
Thank you very much, Nurina. So we now come to the discussion session, but we are over the time limit already a little bit. So I will take all these questions together. Now we discussed different ways in which different approaches to collecting information about food environments and about developing policies, monitoring the implementation of those policies, nudging people or households so that they are shopping better, they are eating better. But with all of that, we are engaging in a very different context in terms of Asia. And Professor Boyd mentioned early on that policies are changing somewhat slowly in Asia. So what can we do together collectively to improve information available in Asia and then use that information to create policy action and also make them effective? What needs to be done? If I can hear from the panelists, whoever wants to go first, that's fine.
I'm sorry,
Yeah,
something's wrong with
yes.
let me just start, but something's wrong with my camera. It tells me I've got a problem there, so I can't turn it on. But these are very good questions, and I don't think there's any single answer to this. I think the challenge that we have as researchers is getting close enough to policymakers to really understand what the window of opportunity is. If they're interested in some particular aspect, then that's the evidence that they want for that thing, like regulating junk food advertising or sugary drinks tax or whatever. And so I think we need to just keep doing these measurements and getting them out there. I think using social media, using other media to be able to get them out there lifted up the agenda. But what specific data they need depends very much on the context and whether the policymakers are ready to act.
Thank you very much, Professor Boyd. And also, before we move on to the next panelist, I want to remind the audience, if you have any questions for the panelists, please post them in the Q&A section, and we can take some time to ask them at the end. Who would want to make any comments next? Sorry, I can't see. Anyone wants to from the... Any responses from the panelists regarding these questions? Or even different perspectives even, because now we heard the importance of monitoring food choices at the supermarket, at the individual level, at the community level. Where should the priorities be? If you have any comments.
I guess I can, this is Eric.
Yes, sir.
Yeah, I mean, I still think that when you talk to people, everybody sort of thinks they know the solution to this very challenging problem. And I still believe, even though we've been at this for decades, that the evidence base for a lot of the proposed solutions is not great. And so I think we need better evidence. And I also think, the reality is that less healthy food tastes better. And I think until we acknowledge that reality, I think a lot of the interventions that we're talking about will fail. And so I think we have to maybe think a little bit differently.
Okay, thank you very much. Also, in addition to these questions, if you have any suggestions, because I think a lot of you ended your presentation saying opening up opportunities for greater collaboration. If you can think of ways in which we can collaborate better to improve food environments in Asia, I would welcome comments on those as well.
I think what we've... I am sorry.
Yeah. So can I say something?
Yes, please.
Yeah. I think the conversation that we had was very very useful, and it's a great conversation because the speakers look at the different aspects of this entire change, the chain of the food system. So it's not only the food environment, but we need to look at the food environment and what people are eating and the outcome as well. I think therefore some of the tools that we have developed, we all have developed, should be coming to a kind of an integrated system. So the shape can initiate such the platform. So we developed our app to look at what people eat, and there are some AI tools to look at the advertisements and the labeling kind of things, and also there are some GIS techniques that we also used earlier to track where the unhealthy foods, for example, are the sold, and not only the unhealthy foods, where the healthy foods are sold, and who are approaching those the shops or the vendors. For example, around the school, there can be many such outlets, and it's very interesting to see what are the foods that the students are buying. So I suggest this forum to think about integrating all these different kinds of aspects together and understand the food environment. Thank you.
Thank you very much, Professor Silva. So any last comments from anybody? Because I think we have only 4 minutes left for this discussion.
I'll just make a
Yes.
comment on the region and getting networked in the region. What we've seen in Latin America is that when one country does it, then that flows over into the next country, and it fortifies the next country to make those similar policy moves. And it has been acting like a domino effect, where they all support each other. They learn how to do the measurements and how to do the advocacy, and they've got local or countries close by that have made a change. And I think that becomes really powerful as well. So that's one of the reasons that Informus is putting, I guess, strengthening the regionality and the networks across Asia between countries, where researchers and NGOs join up and learn from each other, so that infrastructure is there. And then once one country does something, you use that as leverage for other countries to do something.
Thank you very much. Yes, I think that's a very good suggestion. Maybe we can think of doing or initiating something through Shape Asia to facilitate that. So we've come to the end. Do you have any other comments from anyone else? If not, we can move on to the closing. Thank you very much. I will not go to summarize the presentation in the interest of time, but we will prepare a policy brief based on the presentation that will be available on our Shape Asia website. So please look forward to that. And we hope we can engage with all of you, making use of this knowledge, this new knowledge that we have discussed. We can take some initiatives to improve food environments in Asia. So thank you very much. What to you, Dinit?
Thank you very much.
Thank you, Dr. Nisha. And it was indeed a very informative session we had today. On behalf of Shape Asia, I would like to extend our sincere gratitude to all of our speakers and the moderator, Dr. Nisha Arunathilaka. Our appreciation also goes to Associate Professor Elaine Borazon for her invaluable contribution. We also thank our youth representative, Nurina, our partners, and each and every one of you who joined us as participants. We hope that today's discussion will inspire further collaboration and action toward creating healthier food environments across Asia. We will be posting a recording of this webinar on our social media platforms, so please stay connected with Shape Asia for updates on upcoming events and publications as well. Thank you all for joining us. We wish you a wonderful day ahead.